Hello. Thank you for joining us today on Biohacking Your Pain. I am so fortunate, and we are so fortunate to have Cindy with us here to talk about neurofeedback and how it can be able to improve your pain, help you take your life back, punch pain in the face, and get back to leading the life that you deserve. Cindy, thank you so much for joining us today.
Oh, thank you for inviting me.
So, for those of you who don't know, Cindy is phenomenal and has published within the context of alternative medicine and neurofeedback and biofeedback. And we're really going to kind of get into some of the nuanced elements of understanding that. One of the things that we want to show you is some of the works that she's put forth. She's written various different articles in practical pain management that talks about, am I a candidate for biofeedback or neurofeedback for chronic pain? And we're going to talk about exactly what does that mean, so that you can really get into the understanding about how can that benefit you, what's the difference between that, how do you measure it, what are all those different elements that are in play when we talk about the aspects of neurofeedback and biofeedback. So Cindy, can you answer that question right off the bat? Can you explain what exactly is neurofeedback?
Well, neurofeedback is one kind of biofeedback. So with biofeedback, you're measuring something about your body, something about your physiology, and you're giving the patient feedback about it. So information that they can use to change things. So there's different kinds of biofeedback. There's hand temperature, heart rate, muscle tension, respiration rate, skin moisture. And another kind is neurofeedback. So neurofeedback is directly measuring the electrical activity of the brain. And the electrical activity of the brain has to do with your basic brain function, how well your brain is functioning in different arenas. So you're measuring that, and you're giving the patient information through audio-visual feedback that tells them when they're doing better, when they're not doing as well. And they can use that to train their brain, to teach their brain how to work better.
So Cindy, I've heard a little bit about this before, know a little bit about it, and I understand exactly what you're saying, but I know for many people, they're thinking to themselves, train my brain. Well, I mean, I would like do some reading, or, I might, learn a new activity or strategy. What exactly do you mean train your brain? And more importantly, with that, can you give us a background about where neurofeedback comes from?
Oh, okay. So your brain is always active, and it's always got electrical activity. And what you're doing when you're training the brain with neurofeedback is you're changing the pattern of electrical activity so that you can function better. So you're doing something that gets the changes to be unconscious so that your brain always works better. In chronic pain, your brain can be hyper aroused. It can just be stuck in a pattern where your brain is constantly transmitting electrical signals that are too high frequency, and that's what's keeping the pain going. So you're teaching the brain to do something different, to not generate as many high frequency signals and to generate more relaxing electrical signals. So the way that neurofeedback developed is that there was a graduate student, I think he was in Berkeley, Barry Sturman, and he decided to do an experiment to determine if brain waves can be changed with training. So he did an experiment with cats, and he rewarded the cats. He had electrodes on the cats' heads, and he rewarded them when they changed their brain waves in a particular direction. He would they'd get an automatic squirt of milk in their mouth when they were doing better. And he discovered that when you do that, when you reward a change, that your brain does change, and that eventually it'll hold on to the change. So that was kind of interesting to him, and he wrote a little paper about it. And then he went on to do a theoretically completely unrelated experiment where he had a research grant from NASA to look at the toxicity of rocket fuels using cats. And they knew that at a certain level of dosage that the cats would develop seizures. So he started working with this, and he discovered that some of the cats weren't having seizures when they were supposed to, when they were expected to. And he looked at his records, and all the cats that weren't having seizures in response to the toxic rocket fuel were the ones he had trained to change their brainwaves with neurofeedback. So that led him to hypothesize that if you train people to do the same thing, if you train them to make more of a particular frequency brainwave, people who were seizure prone, that they would have less seizures. So he got a grant to do that. And he found that it was true that if you train people to make this, they call it a sensory motor rhythm, they would be more resistant to seizures. So if they had uncontrolled epilepsy, they would have fewer seizures with this training. And then the people that he trained to have less seizures were saying to him, you know, I have ADHD, and my ADHD has been better since I did this training. So then that led to people investigating neurofeedback for ADHD. And then it just expanded from there. At first, everybody in the field was training the same location on the brain with the same frequency for similar things. And then people started looking at, well, what if we train different areas of the brain that had to do with different functions? And what if we train different frequencies? And that, you know, so the field began to expand to treat other conditions and to use other protocols. And now there's many, many disorders that can be treated with neurofeedback that we have evidence for, including chronic pain.
So, Cindy, a few questions for you in that regard, because there's some questions that are coming in fast and furious, but I do want to ask you this. So I know many of our viewers and listeners are going to say, well, how long has this been out for? And if it worked for rocket fuel, did NASA ever look at anything like this? Can you comment on that and whether there's been utilization in other fields?
Well, I don't know how much NASA has used this. I know that they've used it in many different fields for like peak performance. Athletes use it to stay more in the flow of the game and be less distracted. Surgeons have used it to have a steadier hand and better focus when they're doing surgery. People use it who are company CEOs who just want to be more focused, more productive. And then people who have difficulty with physical or mental conditions use it. So, you know, people use it for anxiety, for insomnia, for ADHD, for traumatic brain injury and stroke. And then people use it for pain. So it's being used all over the place. It's become very common in, you know, with elite sports teams, you know, national championship level teams and Olympic teams. It's become pretty widespread there because it really seems to improve people's performance.
Okay, so that's that peak performance and optimal training that you talked about. Now, there's different forms of training, which we don't really want to kind of get into degree of complexity, but this has been out decades, has it not?
Well, Dr. Sturman did his first experiment in 1967, and then I think he published his first paper on seizures in 1968. So it has been around a really long time.
So to that end, why don't more people know more about it? Why is this not more prevalent? Any ideas?
Yeah. I've written a lot about the suppression of alternative medicine, that, you know, when you have something that is not patentable, that's not accessible to pharmaceutical companies to make billions of dollars, it doesn't tend to get much attention, or if it does, there's a lot of misinformation For instance, it was, there were a lot of papers that came out on ADHD and how helpful it was to help people overcome ADHD. And then what happened is that people who were, not interested in seeing that flourish because that would reduce the market for pharmaceuticals for ADHD, they started designing research that was designed to make it look bad. And that's happened with a lot of alternative medicine. And then you can't get insurance coverage for it most of the time. And that, I feel, is, a collaboration between the pharmaceutical companies and the insurance companies to freeze out a lot of alternative medicine, including neurofeedback. So it's hard to get accurate information, to have the media cover accurate information, to get it covered. When you can't get it covered, fewer people want it. And then, you don't have as many providers out there because there's not the demand. So, it all works together so that you don't get a lot of utilization. And that's true with pretty much any alternative treatment that you look at.
So Cindy, I definitely want to talk about some of the aspects of alternative treatments, and I think you've been a major champion for that. And we want to give people references and sites, so particularly before they jump off. So I want to do that. But I do have a quick question for you, because to me, I feel like those individuals who help serve the world and help serve the community, frequently it's a personal experience. So how did you happen to get involved with this? I mean, did you have a pain experience or something that brought you to it? Tell us a little bit about it. I'll be quiet and let you talk.
Okay, so when I was 25 years old, I hurt my back. I was running to get in better shape, and my back just kept bothering me more and more. And I went to a doctor, and the doctor said, stop running, which is pretty typical. And I did, but it just seemed like everything I did made it worse and worse and worse, until the point that I was in so much pain. I was in graduate school at the time. I had to drop out. And I was just in agony 24/7. Nobody could tell me what was wrong. And I was told that it might be the rest of my life that I could be like that. And I was pretty discouraged and depressed. And a friend of mine suggested I read a book she had come across called Anatomy of an Illness, about a man who, Norman Cousins, who used mind-body techniques to heal from a chronic progressive degenerative pain disorder. And he healed himself with laughter. And he also mentioned biofeedback. And I became very curious about biofeedback. I found this psychologist in my area that offered biofeedback treatment. And I just learned how to warm my hands. Warming your hands is one of the indicators of stress. And at that point in my life, I was pretty stressed because I pretty much lost everything, my ability to work, my career, my relationship even. And I was pretty depressed and upset and very worried all the time about the pain. And what I learned is that if you worry, you create physiology that makes things worse. And if you relax, you create physiology that actually makes pain go away. So within a day, just knowing I could have some control over it, because everybody was telling me, the other doctors were saying, we don't know, and it's not within your control, and this may just be it for you. As soon as I found that I could control it, there was something I could do, it just changed everything. And within a short time, I felt much better. I was able to go back to work. I was able to complete my degree. And I worked for a while for the state in an administrative job. But then I decided I was happiest when I was telling people about this. So I went and got training as a biofeedback practitioner. And initially just what they call peripheral measures, but which are, what I mentioned before, hand temperature, heart rate, muscle tension, respiration rate, things like that. Neurofeedback is much more complicated, but when I started to learn about that, it just looked like there was so much potential there that I got trained. And I've been doing biofeedback for about 27 years and neurofeedback for 23 or 24 years. So I've been able to really, work with it and help a lot of people with it.
Okay. So, question for you. You have provided a number of resources for individuals really to be able to kind of take and do their own due diligence and understand about some of the options that they have you not? Can you
Yes.
tell us a little bit? I think you've had both a website as well as a book. Do you mind talking about either of those two for us?
Sure, glad to. So I wrote a book a few years ago called The Truth About Chronic Pain Treatments, The Best and Worst Strategies for Becoming Pain-Free. It is available on Amazon. And what that is it's, now this is about 5 years ago. So I looked at all of the available treatments, conventional and alternative, and looked at all of the research about whether they were effective or not. And no surprise to me, I discovered that a lot of the drugs weren't that effective, and a lot of the non-pharmaceutical treatments were very effective. So the book is, it has a couple of dozen different treatments and how useful they are, when they might be useful. It has interviews with people who used the treatments, who had chronic pain and got better. So that was, I put the book out, and then I was involved in, promoting the book, talking about the book. And then I just got the idea that if I had a website, I could reach more people with it, and it could be more fluid, like I can include more information over time as more information came available, expand the kind of treatments that were available as treatments became more available and as I became more aware of them. So there've been even in the last 5 years, there have been a lot more treatments available. One of the areas that's really expanded is in the area of electrical stimulation therapies for people with chronic pain. And more research is coming out. So what you have on the screen is my website, the Alternative Pain Treatment Directory. It's at paintreatmentdirectory.com. And it also, besides having articles about different treatments, it also has products that I found that are particularly useful that, maybe people have never heard of. And it has provider listings. So if you'd like to go see somebody and get some help, it has massage therapists, physical therapists, chiropractors, people who offer neurofeedback and biofeedback, acupuncturists. It just has people from many different fields all over the country who have a strong interest in working with people with chronic pain. And I'm expanding that every week, adding products, articles, providers. So eventually, I hope it will be the go-to website for anybody who has pain, that enough people will know about it, that if someone says to a friend, I have pain, they'll say, oh, you got to check out this website because it has all this great information and resources.
Phenomenal. So we'll definitely include the link to that website, both on our YouTube page as well as our Facebook page, for those individuals that want to take a look at that so they can be able to get some further information. Out of curiosity, so for those patients who are trying to kind of get a better understanding, can you put in a nutshell the difference between biofeedback and neurofeedback?
Well, biofeedback is more conscious. You're actually learning conscious skills as you go along. So, for instance, in my case, I was learning how to meditate to relax. And because I had the feedback, the information about how successful I was being, that helped me stick to it. It helped me to learn what worked for me and what didn't. So that's very conscious. You can also use, say, muscle biofeedback to teach people how to do the things they do without taxing their muscles so much, using their muscles more efficiently when they're sitting and using the computer, when they're driving, when they're holding the phone or whatever. But most of it is about relaxation. And depending on what the problem is, you might use different kinds of biofeedback. When you get into neurofeedback, you're actually letting your brain figure it out, that unconscious part of your brain figure it out for itself. Our brains are just incredible, and very little of what happens with our brains is on the conscious level. So what, the part of our brains that regulates our breathing and retains our memories and, gets us walking after we've learned how, we don't really have to think, oh, this is how I take the next step, and this is how I take the next step. You're trying to get to that part of the brain with neurofeedback. So you automatically, just as a baseline, are in a better place. You don't have to think about it. You don't have to try. You just have a brain that just automatically does that for you.
Okay. So when we talk about neurofeedback, I know there are some individuals who may think that it is introducing electrical activity into you. It's not TDCS, or they're thinking that you're going to influence their thoughts in some malevolent type way. Can you talk about those potential misconceptions for us, please?
Yeah, so all you're doing is taking measurements. You're not doing anything to your brain but taking measurements. You're putting electrodes at different places on the head, on the surface. You're clearing a little spot on the scalp so you can get a good measurement. And you're just giving the brain information. You're not telling it what to do. You're just giving the brain information. The way that you influence the brain in this way is that you're rewarding the brain for doing more of what you want it to do. So, it's possible to use it for evil, but that's not why most therapists are out there. What you're doing is you're rewarding the brain for, in most cases, calming down, or you might be rewarding the brain for having the different parts of your brain communicate better with each other. But you're doing it by having a more pleasant audio-visual experience for the brain. So in my practice, I'm usually using movies on DVD that work through the biofeedback software and the biofeedback device to change how the movie plays depending on how your brain is working. So the size of the movie on your computer screen can get bigger or smaller or brighter or dimmer, and the volume can change. And your brain just likes a bigger screen, a brighter screen, a louder volume, better. So it's just trying to figure out, what do I have to do to make it go the way I want it to? And in the process, because you've set it up so that when it's more rewarding, the brain is doing better, it just teaches the brain to go in that direction. So you're not introducing anything. You're just saying to the brain, if you do this, it'll be better for you.
Okay. So let me get this straight for our patients and our viewers. So all they have to do really is watch a movie, try not to get frustrated, and eventually through training, it may be able to help improve their pain and other problems. Am I mistaken, or is that kind of close to what?
Yeah, I don't know about the try not to get frustrated, because the way the software is set up, it's not frustrating. The way that most software, the one I use, is set up is that it constantly adjusting to where the person is, where their brain is, and giving them a gentle nudge in the right direction. And the first session, they may notice, that's a little weird. Screen size is changing, but it's set at a comfortable level so that you just get used to it. You don't consciously notice it, but your unconscious mind is paying attention. It's kind of like, you're just going through life, and there's a part of you that's always scanning the environment, to figure things out, but you don't consciously have to attend to. It's been said there's billions of stimuli in your environment at any one time. Your brain is, your unconscious mind is scanning that, and trying to figure it all out. So you could be consciously just enjoying the movie, but that other part of your brain is just figuring it out for you. And it generally doesn't feel frustrating. It feels like, and the kids that come, they just come and they watch the movie. They get very used to it, and um, they don't think about it. It's a fun movie time for them, which is pretty nice when you're talking about a medical treatment, that it's enjoyable for kids and adults.
So I'm guessing you're using more Z-score training versus amplitude.
No, I don't use Z-score training. Oh, I know what you mean. You mean QEEG based training.
Mm-hmm.
So I do both. So QEEG, that stands for quantitative EEG. What that is it's a type of what's called brain mapping, where you're using the standard 19 EEG sites on the brain, just like a neurologist would, to measure the electrical activity of the brain. But unlike a neurologist who just looks at the raw signal and looks for abnormal patterns, in a quantitative EEG, they're measuring how much of what amplitudes are at specific sites, and how much connection there is, how much communication there is between different sites, and actually quantifies it and gives you a report that shows you where your brain is different from normal people's brains that don't have any symptoms that are problematic. And then you get like a guide for where the brain is not functioning normally, and where, if you train it in areas related to the problem, you improve functioning. So I do some of that. Usually I use that with people who have more complex problems, like they've had a brain injury, or they have a learning disability, or they've had a stroke, where I know that there's areas of the brain that are damaged. Autism is another one where the problem can be very complex. But there's also people who come in and they don't have any of that history, but they're very anxious, or they can't sleep, or they're very stressed. And then I use another type of training, which is more functionally based, based on what they're reporting their problems are. And in my case, I use what's called infra-low training, which is using very, very low frequencies, that if you train people to make more of them, it really calms the brain. And I find that for most chronic pain, that's the basis of it. I have had people who come in with migraines, who've had a head injury, and I'll use the QEEG-based type of protocol.
So Cindy, we're getting a number of questions that are coming in. So I'm going to kind of like package them all in one element. And so who would be an ideal pain patient? Are there certain types of pain categories that might be more suitable versus others? Can you give us some insight about that?
Well, I've treated all kinds of pain problems, from back and neck pain to fibromyalgia, CRPS, migraines, tension headaches. I think that anybody, well, I was going to say anybody in pain can benefit, but one of the formative experiences of mine is that after I healed my back with biofeedback, a few years later, I had foot surgery, and after that, my foot was in pain. It took me 14 years to find a solution. And, any mind-body thing, biofeedback didn't work. Any kind of mind-body approach just didn't have any impact. And in that case, the problem was structural. When I was healing from the surgery, so that I wouldn't get pain from the scar, I was walking on the side of my foot, and it, tendons and muscles shortened, and I really couldn't straighten my foot without pain. And that was the problem. So if you have something like that, probably neurofeedback won't help. But for most pain problems, there's a huge component where the brain is involved, and either There's over-arousal that's keeping your body tense all the time, in fight or flight all the time, and that's keeping the pain going. Or if you're in chronic pain, you could have something called central sensitization, where your brain's just stuck, kind of sending pain signals out to the area that's in pain. And it, even though the tissue is healed and you don't need to, pamper that area or be alert to that area anymore, the brain's still sending those signals. So neurofeedback is very good for shutting down those signals so that you don't continue to have that. And neurofeedback is really good for calming the brain so you're not constantly tense and in fight or flight. And, when you're in fight or flight, your body is not in a healing place. It's externally focused on danger, and it's not paying attention to what it needs to do to digest your food, operate your immune system, or do any healing or maintenance of your body. So you want to get your brain in a better place so that your body's in more of a healing state.
Thank you. We really appreciate that. There's a few more questions that I think are for each individual patient. They're trying to get some understanding about how they could be able to implement this. And so previously you made reference to the lack of insurance for most elements of neurofeedback. Can you comment on that and what typical cost might be? And I know that's going to vary from provider to provider, but insight for patients so they feel like it's within their context of something that they can be able to do.
Yeah, individual plans vary. There are some that specifically exclude biofeedback and neurofeedback. People tend to be in better shape when they've got out of network coverage on their plan. I would say that these days a session fee would be anywhere from $100 to $250 a session, depending on who your provider is. So it's an investment. The thing about it that's important to know is that once you complete treatment, the effects are enduring, not like when you take a pharmaceutical or even a supplement, even like medical marijuana or, other kinds of anti-inflammatory supplements. You're still going to need that, going forward. Maybe for the rest of your life. It's not going to fix the problem the way that biofeedback and neurofeedback will. So it's a short-term, sometimes very large investment for people, but you're going to be done, generally speaking.
Okay, so you make mention about, how medications and pharmaceuticals, it's a continual element of use, right? Within those individuals right now who are just trying to find ways to be able to just be functional, and you understand this having been through that aspect of pain, is it possible neurofeedback may be able to even reduce their current medications? And clearly we don't want, you beat me to the punch. So I didn't want to paint you into a corner, but we know that there are different studies that are out there. And actually we have a guest coming in a few months from MD Anderson, who's going to talk about how to be able to reduce meds, particularly after chemotherapy, and some of the studies that she's been able to kind of publish utilizing neurofeedback exclusively. But to that end, I didn't want to kind of steal your thunder. Can you talk about, for patients that are like, man, I just hate being on these meds and how it makes me groggy, but I need it in order to be functional, whether this might be something that could be of value for them?
Yeah, I see a lot of people who are on medication want to get off. And generally what we do is they start treatment with the same, dosages of whatever they're taking. And over time, as they feel better, and preferably working with their physician, they start to gradually reduce how much they're taking. So, that's the way it generally works. You can reduce whatever you're on, whether it's opioids or medication for migraines or even non-steroidal anti-inflammatory drugs, you can gradually reduce your frequency. And for some of those drugs, you want to be careful because abrupt cessation will put you into withdrawal, which can in some cases be either very unpleasant or dangerous, which is why you want to be working with a cooperative physician if you're going to do that. But generally speaking, people just find they don't need as much. And, eventually they don't need anything at all. So, it's very effective that way. You don't have to start off stopping everything. I would certainly not advise that. People should take, what they need. And then as they feel better, they can start to gradually reduce what they're taking.
So, Cindy, you mentioned physicians. Now, be careful. I'm a doctor.
You're a physician.
I'm a doctor now, and you took my call and you were gracious enough to be able to present here. But as we know, there's a number of traditional MDs and DOs that don't necessarily believe in neurofeedback, and they say, it's hogwash. You can't rewire the brain. Those things don't really exist. Can you be able to help provide viewers an understanding of where they can find resources and how doctors, sometimes our exposure just isn't always as grand as it should be in terms of understanding what are the options that can be able to help people? Clearly, I'm going to kind of steal your thunder real quick and talk about, you can find some of that on your site, right? But but some of that other elements of understanding, where is the literature behind this? Many times docs will say, oh, there's no literature. Can you refute that and tell us a little bit about it?
Well, there is literature. In terms of chronic pain, I compiled it for an article I wrote for the Practical Pain Management Journal, where I referenced in my discussion different studies and then gave the references, the citations at the end of the article. Unfortunately, there's not a tremendous amount of research on neurofeedback and pain. There could be a lot more, but there isn't. And a lot of that has to do with funding, and that there aren't a lot of funding sources for studies like that. I mean, one person who's very prominent in the field of trauma, he wanted to do a study on using neurofeedback for traumatized children. And he's published articles and done lots of research in many areas, but he ended up having to crowdfund his study on using neurofeedback for trauma in children. He went to like GoFundMe or one of those to get the funding. That's how difficult it can be to, and he's an MD, he's a psychiatrist, so he has the right credentials, had published widely, but still couldn't get any funding. So there isn't as much research as we'd like. There's an organization, the International Society for Neurofeedback and Research. It's isnr.org, and they maintain a bibliography on their website of all the research. Well, I should say it's not as comprehensive as it used to be, because when I was researching the most current stuff on neurofeedback for pain, it wasn't as up to date as I would have liked, but there's hundreds of studies cited on there. So that's one place that you can go. Are you there?
I'm definitely here. I haven't.
Okay.
I'm just doing some technical stuff here, showing your ISNR that you made reference to. That really allows for you to be able to kind of see some of the aspects of the different journals and articles that are in place, as well as multiple different books that have been really referenced in terms of talking about this type of topic. So ISNR is the National Neurofeedback Organization. There are other websites where you can get information. There's one, the infralow frequency was developed by Sue Ottmer, and they have a website that talks a lot about that. That's eeginfo.com. And that's a really good website for learning more about that particular focus. So one quick question for you. For patients that have kind of that emotive feeling of saying, you know what, who have you really been able to help where it's touched your heart, it's changed their lives? Can you give us an example of a patient that really you made a huge difference and they were just fortunate to have found neurofeedback and you?
Yeah. Well, there have been a lot of them. There was a young man who I think was about 30 when he came to me. He had been involved in an industrial accident where a heavy piece of equipment fell on his back and crushed it. And he had surgery, had spinal fusions and whatever. And he was functional, he was working, but he was in constant pain. He was on opioids. And he did a little over 20 sessions of neurofeedback with me, maybe 23. And he was pain-free and able to get off of his medication. So that was one person. I had a teacher, special ed teacher, who was, she was getting migraines almost constantly. It was really interfering with her work. She was a very dedicated teacher, and it was very distressing to her. And in her case, we used the QEEG-based training, and she became migraine-free from the treatment. And she was in her 50s. She had had migraines her whole life, and she became migraine-free after the training. I've had kids with abdominal pain. I had one girl who she kept going to the hospital. She couldn't keep any food down or water. She had to go to the hospital and get IV because she just couldn't stop vomiting. And neurofeedback helped her. She didn't have any problem after doing a course of neurofeedback. So, there have been a lot of different people with fibromyalgia who, had a great reduction in their fibromyalgia symptoms with neurofeedback. So there have been many people over the years whose lives have been changed from working with me.
So as we start wrapping this up and giving references for patients also to kind of find this video and going forward, one of the things we have is a little ticker down there below where people can be able to figure this out on the YouTube channel, but we're also going to refer them back to your site as well. Let's say I pose this question to you. 3 years from now, if we're reflecting back to the amount of hopeful progress that has taken place, what has to have happened both professionally and personally for you to feel like we've been able to bring neurofeedback to the fore and really be able to give an offering to patients that otherwise they haven't had?
Well, I have a broader focus than just neurofeedback. I mean, I would like people to be able to find out about all the options for chronic pain that are out there, and there are many of them, and for them to be funded by insurance companies. I would like my website to be something that everybody knows about and goes to when they have a question about how to deal with chronic pain. And I have drafted a legislative proposal I call the Pain Treatment Parity Act that would require insurance companies to pay for all of these treatments, including neurofeedback, including medical marijuana, including as much chiropractic and PT and acupuncture as people need. So I would like to see that happen. It's hard to imagine today that 3 years from now that much can change. But I would like, I'd also like doctors to be trained. Right now, doctors get less than 2 hours of education on pain in 4 years of medical school, and their journals don't cover these alternative treatments. So I would like to see doctors know all about this. I'd like to see patients know about this. And I would like to see insurance companies required to pay for neurofeedback and other alternative pain treatments. I'd like them to be mainstream. I'd like to have a stop having to say alternative because they're accepted and everybody has access to them.
So again, kind of referencing where we can find you online, this is your website that is paintreatmentdirectory.com that patients can be able to reference and look at all those different alternatives that are out there. And they can be able to also connect to you, can they not? You have a contact number here of 518-439-6431 where they can be able to reach out to you.
Yes, that is my office number
Okay.
for the directory and for my practice. And I also want to mention that I do phone consults that people can schedule on the website to just help guide people to the most likely treatments that can help them. So I go through their history, their treatment history, their pain history, and the history of their, what they've done to treat it. And then, I can make suggestions for what's most likely to help.
Okay. Cindy, is there anything else that I may have missed in talking about neurofeedback and how it might be able to benefit pain patients as a whole that you want to add?
I think you've been pretty thorough, actually.
All right. Well, thank you so much for joining us again. Hopefully, we may be able to have you back to talk about some other therapies if you'd be willing to do so in the future.
Sure.
Because I think having patients know their options, it empowers them. It allows
Yeah.
for them to be able to have autonomy and direction and choice about what it is that they want to be able to do. And many patients that I see, particularly in pain, come and they feel like they've reached the end of their rope. And people have told them, this is an option I have. And if you don't have it, or rather, if you don't want it, you can take it or leave it and you can go and you could just be in pain. And I think that
Right.
there are many patients that don't know that there's a multitude of different things that may benefit them. And the more that they have an understanding about that, the better they can be able to lead a functional life.
Right. I agree with you. There's just so much out there that the doctors won't tell you about. That's why you have to research it yourself. And, I'm not anti-doctor, but I do think that doctors' education in this area is very restricted and they just don't know. So you're your own, patient is their own best advocate.
Indeed. So thank you so much, Cindy. We really appreciate you being here with us today. And thank you for those of you who tuned in to us. And you can find this video on our YouTube channel going forward, so you can be able to reference it, find Cindy and be able to look her up and hopefully be able to get over that pain, punch pain in the face, and get back to leading the life that you deserve. Thank you so much.
Thank you.